So, hello everyone. I am Sridharan, Assistant Professor from the SNS College of Physiotherapy. So, in this video, we're going to see about the topic is group exercise in the exercise therapy. So, this video mainly concentrate on the how this group exercise mainly rely in the exercise therapy, which mainly concentrates on the definition, advantages, disadvantages, and the practical applications and the comprehensive guidance towards the group exercise for treating the patients as well as also for treating the sports persons. Our aim is to highlight how collective effort can be significantly enhance the rehabilitation outcome measures. So introduction and the defining for the exercise therapy is, so exercise therapy is the structured program for the physical activities designed to restore the normal musculoskeletal function and as well as also reduce the pain and to prevent the disability. The main goal of the exercise therapy is to improve the strength as well as also flexibility, balance, and the endurance. So the modalities which have been used for the exercise therapy are individual programs, which is nothing but the tailored exercise for the specific and the individual patients. And second one is the home exercise program, whereas the instructions were be given to the patients to continue the therapy independently. So third one is the group exercise, which is the supervised session of for the multiple patients with the similar needs. And final one is the aquatic therapy. So these exercises performed under the water to reduce the joint load and as well as also to improve the mobility in the patients. So why the group exercise matters in the rehabilitation? So the group exercise mainly shows this shared experience and as well as also the enhanced communication and also gives the peer support to the patients. So the shared experience, the patients realize that they are not alone in their struggles as well as also fostering the empathy and the mutual understanding between the patients. And the second one to enhance the communication. So the opportunities for the patients to discuss the challenges and the success going through their period of time in their rehabilitation phase. And final one is the peer support level. So encouragement and the motivation from the fellow participants, creating the positive and the uplifting atmosphere among the group of patients. So these are the main things that may be focused on the group exercise during the rehabilitation phase. So now we're going to see about the advantages of the group exercises. So the four main advantages which mainly concentrates on the group exercises. First one is social connection. Second one is the increased adherence. Third one is the motivational boost, and the final one is the cost efficiency. So the social connection mainly reduces the feeling of the isolation and the increased adherence, which mainly structure the schedule and the accountability to the group, lead to the higher attendance rate and as well as also the consistency level among the patients. And third one, the motivational boost, which gives or which mainly concentrates on the friendly competition and the shared progress that inspire each other among the patients. And final one is the cost effectiveness. The group sessions may be more affordable for the patients and the more efficient for the therapist compared to the one-on-one sessions. So now we're going to see about the disadvantages of the group exercise. So there are varied individual needs and the higher risk of over exaggeration and the limited individual attention. So the individual needs may be varied to the one patient to another. So this may be one of the major disadvantages of the group exercise. Then risk of over exaggeration, the individuals might push themselves among the one-on-one for increasing and showing their competitive spirit among the patients. So this can lead to the risk of over exaggerations. And the final one, limited individual attentions are, which may be beneficial for many, but the group format inherited offers less personalized one-on-one sessions. So the indications for the group exercise are the chronic pain syndromes, post-surgical rehabilitation, cardiovascular rehabilitation, and final one is balance and the mobility deficits. So the chronic pain syndromes, patients with the conditions like fibromyalgia or the chronic lower back pain often benefit in the structure, and the patients we have been recovering from the post-surgical conditions such as hip replacement or knee replacement may progress well in the groups, focusing on the rearranging their range of motion and the strength. And the patients recovering from the cardiac events finds the group setting ideal for the supervised exercise and as well as also for the ideal lifestyle education. and it also helps in the balance and the mobility deficits. Elderly individuals on those on the neurological conditions benefits from the group exercise targeting the balance, gait, and fall prevention in the safe environment. So these are the formation for the group, and the principle for the design and the patient selection are thorough the assessment among the individual of the patients, homogeneous grouping, whereas the homogeneous grouping based on the similar diagnosis, level of functions, and the rehabilitation stages. Third one is the optimal size of the group, and final one is the clear the objectives which define the specific, measurable, achievable, relevant, and the time bound goals for the group program. So these are the overall view among the group exercise in the exercise therapy. So see you on the next video. Thank you.